Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order, and this is quite convenient for your study. My dear friends, as you know, we were discussing about rickets in children. In this series we have already covered 3 classes, so which explains almost all the basics of rickets. In the last class we described about the formation of the growth plate, and now we know that two major minerals which are involved in the formation of mineralization of the bone, that is phosphorus and as well as calcium. And phosphorus and as well as calcium, they always exist in the body in the dynamic equilibrium. Okay, so if phosphorus is absorbed, then also calcium is also absorbed, and if the phosphorus is lost from the body, meantime calcium also lost from the body, and vice versa. And this is a situation, this is a kind of friendship that these two minerals they maintain, phosphorus and as well as calcium. A similar type of things also exist with the water and sodium. Anyway, one of the major mineral which is important for the formation of the osteoid of the bone for the mineralization is calcium, and absorption of this calcium is possible only in the presence of vitamin D. Now it is not enough to concentrate only on the calcium. It is also very important to focus on vitamin D, whether vitamin D is available in the body in the sufficient quantity or not, or whether there is any pathology related to vitamin D absorption and all, which is indirectly or directly affecting the absorption of the calcium. That is also very important. What I mean to say is calcium absorption is 100% depends upon the presence and absence of vitamin D. So this being the case, when we study the rickets, it is very important to understand vitamin D also. So we will take 1 or 2 classes for the detailed understanding of vitamin D formation and its presentation and its absorption and also its functions, etc., and its role in the prevention of rickets. So let us start with the vitamin D synthesis. Now 7-dehydrocholesterol is present underneath the skin, and this is a kind of cholesterol which is present underneath the skin, and dehydrocholesterol and ergosterol, these are the 2 important precursors of vitamin D. 7-dehydrocholesterol is a precursor which is actually present underneath the skin, whereas ergosterol is one which is present in the dietary backup. That means through the diet is available. Now we will start with the 7-dehydrocholesterol which is present underneath the skin, and when sunlight falls on the skin with a wavelength of 288 nm ultraviolet light, this 7-dehydrocholesterol is get converted into the vitamin D. In the vitamin D there are so many steps that we'll go into discuss now. And 288 nm of UV light, there is a lot of controversy about this when it is available. So according to the present research work, it is told that 10 am to 3 pm in between, so this particular wavelength light is available, and when sunlight of this particular wavelength of 288 nm when falls on the skin, the 7-dehydrocholesterol which is present underneath the skin will be get converted into the next form of the vitamin D. Now whether this is true all over the globe, globally, that means in the various geographical areas, the intensity of the sunlight is different, and therefore it is quite difficult to assess this zenith. There is an angle called a zenith angle, and a few research also says that the light should fall with the angle of zenith angle, then only it is having this particular wavelength and this particular quality of ultraviolet rays. Anyway, that we'll discuss later. This is one part. Second part is little of the vitamin D is also given through the diet, which is basically it is ergosterol. Now both these forms are called as raw form of the vitamin D. 7-dehydrocholesterol and aldosterol available through the diet. The both are considered as a raw form of the vitamin D. This vitamin D, once it is activated or absorbed, now it will goes to the liver. In the liver, this raw form will be converted into the next stage by means of an enzyme which is called as 25-dehydroxylase enzyme, and this raw form of the vitamin D will be converted into 25-hydroxyl vitamin D in liver in the presence of an enzyme called as 25-dehydroxylase. This is the first form. So now this particular 25-hydroxyl vitamin D is considered as the storage form of the vitamin D. So this is, see, only few of the vitamins are stored in the body, like vitamin A and D. So vitamin D is also stored to some extent in the body, and this 25-hydroxyl vitamin D activated form, so this is called as a storage form of the vitamin D. So this is the one which is gets stored in the body. Now what happens, this 25-hydroxyl vitamin D will further goes to the kidneys. Okay, this will further goes to the kidneys, and in the kidney they come across with the enzyme called as 1-alpha hydroxylase. Okay, so this already storage form of the vitamin D which is formed in the liver, now it goes to the kidney. In the kidney it will met with the enzyme called as 1-alpha hydroxylase, and this 1-alpha hydroxylase enzyme convert the storage form of the vitamin D, that is 25-hydroxyl vitamin D, into its next form which is called as 1,25-dihydroxy vitamin D. So 1,25-dihydroxy vitamin D. So this is converted by 1-alpha hydroxylase enzyme. Now this is the pictorial presentation where the vitamin D is present, and the 25-hydroxylase enzyme converted into 25-hydroxylase vitamin D in the liver. Later it goes to the kidney. In the kidney it is converted into 1,25-dihydroxy vitamin D. Now this 1,25-dihydroxy vitamin D, what we are now calling, so that is also called as calciferol. So rather calcitriol. It is also called as calcitriol. Okay, so 1,25-dihydroxy vitamin D is also called as another name called as calcitriol. Calcitriol. Now what is the next step? Now this 1,25-dihydroxy calcitriol or hydroxylase or calcitriol, what we call, it is considered as the most active form of the vitamin D. The first one is the storage form of the vitamin D, which is happening in the liver, whereas what is happening in the kidney, so that is called as most active form of the vitamin D, and this is called as calcitriol. Now when this active form reaches the blood, it helps in the calcium and phosphate absorption from the intestinal cells and also from the other parts of the body. So this is the story. Okay, so now calcitriol, that is the last form, active form, which is formed in the kidney, that is very important. The storage form is not able to absorb the calcium and as well as phosphorus. Storage form is usually get converted into the next calcitriol form, absorbable form. Okay, active form. Okay, therefore it is not the storage form which is very important, it is rather the active form, that is calcitriol, formed in the kidney, that is very, very important. The reason is this is the most active form, and this is the one which will go into help the absorption of the calcium and phosphate from the intestine and other parts of the body. Calcitriol also works by other methods also. For example, they also, as well as by decreasing the excretion of the calcium and also phosphorus from the urine. One is this calcitriol that will go into increase the calcium absorption and phosphorus absorption from the various parts of the body and intestine. Meantime, this is the form which also helps to decrease the calcium and phosphorus loss through the urine. Okay, so that blood calcium and phosphorus level will be completely maintained. So this is the story. This also prevents the excretion of the calcium and phosphorus. this also increases the absorption of the calcium and phosphorus, the most active form of the vitamin D, that is called as calcitriol. Now come to the another part of the story. Calcium is added to the blood by means of an enzyme called as PTH. Okay, vitamin D is important for the absorption of the calcium, we know that, yes. From where actually blood will get the calcium? In the blood, calcium, from where it comes? Of course, through the diet it comes to some extent, but directly not from the diet actually. Calcium into the blood will be given by an enzyme called as PTH, parathyroid hormone. Now, parathyroid hormone causes the bone resorption by breaking the osteocytes. Now, this is the story. In the bone, there is a lot of calcium is there already. Whenever blood needs the calcium, that means if the blood calcium level falls down, then immediately parathyroid hormone will release the calcium from the bone into the blood by causing the bone resorption. To some extent, bone decay. It will break the bones, and from the bones, the calcium which is present stored there, so that will comes to the blood. Now you can ask the question: if you remove the bone calcium, then the bone will be weaker, isn't it? But it is not like that. There will be a dynamic equilibrium existing between the parathyroid gland and as well as the blood. That means, if the calcium in the blood is more, then it will be taken into the bones. If the calcium is less, then it will be taken from the bone into the blood. So when there is a less amount of active vitamin D, now what happens? When there is a less amount of active vitamin D in the blood, okay, suppose the alpha hydroxylase enzyme is absent, okay, as a result, active form of the vitamin D is not formed to some extent. So now what happens? When there is less amount of the active vitamin D in the blood, then the parathyroid hormone will going to stimulate the 1-alpha dehydrogenase enzyme and increase the production of the same. So this is actually what happens. Now vitamin D is less in the blood. When the vitamin D is less in the blood, calcium absorption cannot take place. Now this increased active form of the vitamin D, okay, is less in the blood. In this moment, what happened? The parathyroid hormone gland will going to stimulate the 1-alpha dehydrogenase enzyme which is present in the kidney, which is responsible for conversion of the storage form of the vitamin D into the active form of the vitamin D, or calcitriol. So two important functions will be carried out by parathyroid hormone. One is, it is helpful to maintain the dynamic equilibrium between the blood and the calcium and bones. Second one is, whenever there is a need of active form of the vitamin D, it is a parathyroid hormone which will stimulate the 1-alpha hydroxylase enzyme and make it possible to convert the storage form of vitamin D into the active form of the vitamin D, so that calcium will be get absorbed. So similarly, when there is high calcium in the blood, this is what we call as dynamic equilibrium. Similarly, when there is high calcium in the blood, there will be decreased production of the PTH. As soon as the calcium level is more in the blood, immediately the parathyroid hormone stops the secretion or decrease the secretion of PTH, and now there is less stimulation of 1-alpha hydroxylase enzyme, and as a result, the calcium level in the blood will be maintained. Calcium level in the blood is maintained. In any condition where the calcium goes down, immediately the parathyroid hormone stops functioning, and as a result, there is no stimulation of 1-alpha hydroxylase enzyme. As a result, there is no active form of the vitamin D. As a result, there is no absorption of the calcium from the blood, and as a result, the calcium level in the blood will be maintained. So this results in formation of less active form of the vitamin D, and this is called as feedback mechanism. This is called as feedback mechanism. In other words, this is also called as dynamic equilibrium of the calcium and bone by means of parathyroid hormone. The peak incidence of rickets, as we know, It is always between 3 to 18 months of age. This is basically a disease which starts in the early infancy. Now, what is the role of vitamin D and parathyroid hormone? This is in short in the table form I have given. Vitamin D in the kidney, the active form of the vitamin D, so that will calcium absorption increases and phosphorus absorption increases. In the bone, vitamin D is responsible for increase the mineralization of the bone. And in the intestine, vitamin D is responsible for increased absorption of the both calcium and phosphorus. Similarly, the role of PTH in the kidney, PTH increases the absorption of the calcium. It decreases the absorption of the phosphorus. In the bone, PTH, it causes the mobilization of the calcium in the blood by increasing the calcium level of the blood. Whereas in the intestine, the PTH will increases the absorption of both by means of vitamin D. Now, this is in short. So, in the next class, we will going to discuss about the vitamin D synthesis. Thank you very much.